Welcome to session 6 of anger management. This is Dr. Justin Dorenzo again. Hope you've had a good week or good past few days. What I want to do is check in first and want to review how you've been regarding managing your anger. Let's check in. What number did you reach on the anger meter over the past few days? So what was the highest number? Describe the specific event that led to this. What were some of the cues you felt or experienced? And again, try to identify one or two from each of the 4 categories. What kind of technique did you use to try and control your anger? And how has your anger plan been working? So again, remember the event, the cues, and then the strategies. And the last section, we learned about 2 types of cognitive restructuring. We've already have been talking about thought stopping, but we learned about the ABCD model as well. So again, review the anger meter, cues to anger, importance of finding or coming up with an anger control plan. We've learned about breathing exercises. We've learned about the aggression cycle, and then cognitive restructuring. So this session is mainly review. To make sure that we understand fully the concepts, as well as to galvanize the entire course and ensure that we are taking away some things that we can use effectively in the future. So let's remember what the anger meter is. A good way to keep a tab on our level of anger. It's a way to see improvement or lack thereof. We should always report to the anger meter after using anger control strategies. So remember that you've been doing this course for several sessions. Hopefully, as your plan is working better and better, you'll see that the number on your anger meter has continued to decrease. Again, 10 is that explosive behavior, violence, loss of control, negative consequences. 7 is kind of that warning, danger area, increased anger, losing control. 3, some irritability, and then 1, 0, completely calm and no anger. Cues to anger. So our cues to anger help recognize when our anger is escalating so that we can begin to use strategies to attempt to control it. So remember, we have the physical cues like increased heart rate, sweaty palms, etc. Behavioral cues, yelling or screaming, slamming doors, fighting. The emotional cues, fear, jealousy, disrespect, etc. And then the cognitive cues, like kind of having fantasies about our thoughts, aggressive images, hostile self-talk. So it's kind of the fantasies about hurting people or ourselves. Sometimes you're destroying property. Alright, anger control plan. This is your own unique plan to control your anger. You should pick tools that work best for you, whether it be the timeout or the ABCD model. This is a plan that should keep you from reaching a 10 on the anger meter. If you do reach a 10, it might be time to practice your tools more or change up your anger control plan. So let's review the aggression cycle. Remember, we first talked about the escalation phase. If we reach a 9 or 10 on that anger meter, that's the explosion phase. And then we move into that post-explosion phase where there's the consequences, the guilt, the shame, the jail, getting kicked out of the house, a job, losing a job and things like that. So remember what the escalation phase is: denial, minimization of incidents, increased and hostile talk, intimidating body language, more frequent and intense anger. Again, to the explosion phase: violence, verbal aggression, uncontrollable discharge of tension, major destructiveness, and then that post-explosion phase. So the aggression cycle, it should be used in accordance with the anger meter, as I said. And the idea is to break the aggression cycle and avoid the explosion phase by using the strategies in your anger control plan. Again, cognitive restructuring, we need to reconstruct our cognitions because faulty thinking is often related to anger problems. We do this by examining and changing our thoughts or by simply stopping our automatic thoughts. So we learned about the ABCD model, a systematic process to attempt to dispute our automatic thoughts and irrational beliefs. And then thought stopping, simply stopping our automatic thoughts. And I said, recommend the best way is to use some type of distraction technique, think about something else, or leave the premises. Session 6 exercises. So over the next couple days, next week, I want you to continue to rate your anger level on the anger meter and begin to rely on a strategy that works for you. Also, continue to practice progressive muscle relaxation, body scanning for tense muscles, and deep breathing exercises daily. This concludes session 6.